Greetings. This is Brother Dr. Abdul Halim Muhammad, and this is One Black Man's Opinion. Recent news reports have announced that Pfizer and other pharmaceutical companies have come up with a vaccine for the COVID-19 virus. The increasing number of deaths and infections has many in the population of America and throughout the world in what one would call a panic. The news media is amplifying this panic through its constant reports and counts of death and infections and hospitalizations. And now they tout these vaccines as being the hope that's on the horizon. However, there are many in the United States and throughout the population, specifically Black, Hispanic, and Indigenous people, who are very reluctant to take the vaccine, despite the fact that Blacks, Hispanics, and Indigenous people are dying disproportionately. But why are they dying disproportionately? There's underlying health disparities regarding their diet, and in these communities there are food deserts. There's also the presence of illegal drugs and even prescription drugs that are being abused, alcohol consumption, tobacco consumption, obesity, diabetes, asthma, and cardiovascular diseases. To the national leaders who are urging Black people, Hispanic people, and Indigenous people to step up and take this vaccine, I say to you that you must now address the reluctance that these communities have in taking this vaccine. As it relates to Black people, it's not just the Tuskegee experiment. It is the experimentation, misuse, malpractice, experimentation that has been done on Black people from colonial times to this very day. Until you address these criminal acts that have taken place against Black people by the medical and health professions, until you address the health disparities that are underlying and are the reason for the disproportionate hospitalizations, deaths from COVID-19, you will not get Black people to take this vaccine. The Honorable Minister Louis Farrakhan says, we will not take your vaccine because you have a record that is not one that is trustworthy whatsoever. Until our own virologists, epidemiologists, biologists, and chemists look at this vaccine, review the data, and approve it to be safe, until our virologists, epidemiologists, biologists, and chemists look at the long-term effects of taking this vaccine, we will not take it. We're more trustworthy of the Cuban medical system that has found a way to flatten the curve of the coronavirus and has treatments and protocols that has indeed stopped the spread of the virus. Why don't we take these sanctions off of Cuba for humanitarian reasons? Why don't we open up the dialogue between our medical community and their medical community? Could it be that it's a profit motive? Could it be that we have now put profits over people? Could it be that the vaccine that is being touted as being free for the people, really for Big Pharma, there's a silver lining, meaning they're going to line their pockets with silver, either through tax breaks or write-offs or additional funding from the government? This is not emotionalism. This is not conspiracy theories. This is not speculation. The reluctance of Black people to take this vaccine and to trust the medical profession is based upon historical facts from colonial times to today. So if you want us to take this COVID-19 vaccine, then you're going to have to account for the mistreatment, misuse, malpractice, and evil experimentation on black people from colonial times to the present, you're going to have to provide the data to our virologists, epidemiologists, biologists, and chemists so we may look at the data and we may look at the long-term effect of this vaccine. And lastly, you must open up a dialogue of communication, taking the sanctions off of Cuba, so that at least for humanitarian reasons, we'll be able to connect their medical system to our medical system so we may study what they're doing right, what we're doing wrong, what we're doing right, and what can improve their system. And lastly, to better understand black people's reluctance to trust the medical and health professions, I highly recommend you read the book, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present by Harriet A. Washington, or take out a subscription to the Final Call newspaper. This is one black man's opinion. What's yours? I'm Brother Dr. Abdul Halim Muhammad.